Hello, everyone. Good afternoon. I'm Saita from beautiful Spotless Skill team, and I'm sure all of you must be keeping good health. Hair is the first thing that people normally notices about you. A great hairstyle can give you the personality boost you require in doing well in both personal and professional fronts. Black, luxurious hair is the crowning glory that you would never want to take off. But have you noticed many people, especially young generation, started developing gray or white hair quite early in life? This is scientifically known as premature graying of hair, PGH. It starts before 25 years of age and it can severely affect the self esteem of an individual. It can be a shock to find your first gray hair on your head, especially if you are only in your 20s. The prevalence of premature graying of hair was found to be as high as 27.3%. Thankfully, effective hair treatment and early consultation from the expert can actually control this process. But what remains the concern is the awareness of this hair concern. So we are here to know more about premature graying of hair from an expert. So let's connect today with our expert, Dr. Kavitha, live from Bangalore, to make us aware on premature hair graying, which is a big concern. So Dr. Kavitha GV Mandal is the best lady dermatologist in Bangalore. She has more than 25 years of rich experience. She is a senior consultant dermatologist who takes keen interest in aesthetic dermatology, laser, Botox, inject-able dermal fillers, anti-aging services, hair care services, etc. Through her elaborate career, which spans from 2006, she has presented papers in various international conferences, attended international workshops, and has been trained in advanced aesthetic dermatology. She is an active member of BTA, Bangalore Dermatological Association, and IADVL. She is the director and consultant SK True Derma, Sarjapur Road, Bangalore, which is near Wipro. A very warm welcome to you. It's such a pleasure to have you with us, Dr. Kavitha.
Thank you for your lovely introduction, Samyukta. Hello, good morning, everybody. So here I am to talk about premature graying hair, which is a concern.
Yes, Doctor, and these days, due to the environmental effects or the other things, because we all are leading a very stressful lifestyle these days,
Yeah.
we can see a lot of premature hair graying, especially those who are in their 20s, even teens, they come up with gray hair and that do affect, our self-esteem and it do impact our personality. So what is exactly this prematuring of hair graying?
So when we graying process is a part of aging process, but when we say premature hair growing, when a person starts graying before 25 years of age, like between below 25, 20 years of age is called as premature graying of hair.
Right. So if a person is having gray or white hair before 25 years of age, then he or she falls under premature graying of hair. What are the causes, doctor?
See, there are many causes, but exact cause is still unknown. It might be due to genetic. Like if your parents had history of graying at an early age, then you would likely to get gray hair, and it is also associated with autosomal, dominant diseases, and also premature aging syndromes like Pangeria, Progeria, and also it is associated with autoimmune diseases like pernicious anemia, where there is a defect in absorption of vitamin B12, and like thyroid disorders, both hyper and hypothyroidism, and other pituitary disorders. Like all these are autoimmune diseases associated with premature graying of hair.
Right. Doctor, are there any other factors in our day-to-day activities which contribute to hair gray?
Yes, there are many factors, which is related to any underlying medical issues and vitamin deficiencies and other lifestyle, like habits, like other environmental pollution and all. Like first and foremost is like we have whenever a person walk into my office with seeking for premature graying, I always ask the history, whether like when was the onset of graying, and history of parents, like a history of parents having gray hair at their younger age. And we have to do investigations. We have to rule out, any hormonal issues like thyroid, pituitary, and other autoimmune diseases. And also, definitely, we have to, investigate about underlying vitamin deficiencies, especially iron deficiency, vitamin B12, D3, zinc deficiency, ferritin, calcium, and definitely pernicious anemia. And other factors, a person who has exposed to sustained sunlight exposure, like both UVA and UVB, there will be oxidative stress in the hair follicles, which lead to melanocyte destruction, and where there is lightening of the pigment, and definitely it leads to premature gray. And other usage of chemical agents, like chemical agents where there is accumulation of hydrogen peroxide. And if a person has gone through acute psychosocial stress, definitely, and consumption of alcohol, like chronic smoking, which leads to oxidative stress, also lead to, premature graying. And certain people who are receiving anti-cancer agents, like chemotherapeutic agents, and few people are put on anti-malarials, especially chloroquine for some reasons, they also tend to develop premature gray. And last but not the least, another autoimmune diseases like vitiligo, alopecia areata, like these are all inflammatory conditions associated in our body, they also have lead to premature gray.
Right. So there are a number of causes, definitely, and a number of activities that we, do in our day-to-day life, which can lead to premature graying of hair. Now, the thing is, doctor, as you said, it's very important to diagnose the cause, right? But what we do in a very normal practice in our society is to go for home remedies or to go for over-the-counter products, or because there are so many influencers these days on various social media platforms, and they have these quick fixes, right? Quick fixes remedies. So we fall for them. And what happens that after a certain time, when we realize that these, DIYs are not working or are having other, side effects, that's when we realize we need to go and consult a doctor. What's your advice? What's your take on these home remedies or quick fixes or over-the-counter products? Because there are so many products in the market which claims that they can, reverse the process. If you have started premature graying, will convert them into black. So what's your take on all these?
See, first and foremost, there should be, awareness that a premature graying of hair, identified at an earlier stage. When they start identifying with, only less, 10 to 20% of hair is affected, and they identify it can be treatable, and they seek a dermatologist opinion, definitely it can be reversed, they should go to a dermatologist and ask what are the treatments available, and take the advices and take the treatment adequately. Definitely the hair can be reversed naturally, and even whatever the the further preventing of the hair graying hair also would be prevented. But there should be awareness, and they should come to the doctor. The early and adequate treatment is very important. But if at all the graying is too much, and they realize after 25 years, like my hair is started graying, and they come to me, then I'll say okay, now it's 25 years. It's too late, and but whatever, definitely we have to, if any medical issue is there, we have to treat the cause. And if any vitamin deficiencies are there, we have to treat, give supplements, micronutrients. But it takes long time to respond. The patient has to be explained about the long-term treatment, and the response will be very late, and adherence to the treatment is very, very important. And any acute psychological, emotional stress should be taken care, and they should be counseled about smoking, alcohol, and all, which, like stopping of alcohol, stopping of smoking can be reverse the premature graying of hair. And taking a good, healthy, balanced diet, following a good, healthy lifestyle will definitely help them. But there are no any natural remedies, like you see lot of things in on counter, like Insta, in other social media. There are no any natural remedies. It's not a they're all not reliable. But yeah, these days few like serums are available, which are US FDA approved, which has melatonin 5% and N-acetylcysteine, which can be applied on the hair daily, on the cleansed hair, so that like the person, like, but they it has to be started before 25 years. There's no like I suggest them to identify the premature the graying as early as possible. If a person starts from 18 to 20 years, if they identify it and start, nothing like we can. I have treated at my clinic successfully. Like if they come, like if it is premature graying, it would have started by the age of 16, 17, 18 only. But only thing is, coming to a doctor, taking a proper advice is the important thing for like 80 to 100% improve. I have seen success. I have treated successfully in my patients. And yeah, if the person comes after 25 years and if they have history of like family history, then I have to counsel them. It's a as a part of aging process, and go for like safer oxidative semi-permanent dyes are available, which are PPD free, ammonia free, so that they can go for, so that it camouflages their gray hair, and it gives also a good cosmetic camouflaging effect, so that they don't lose their self-esteem. And it gives a like lasting effect as well.
Right. And as you also mentioned, that diet is very important. When we go deficient on certain vitamins, micronutrients, macronutrients, we do start premature graying of hair. Now, my question is, doctor, what should be our diet like? I mean, if we go for hair health or as a preventive measure for premature graying of hair, what should we include in our day-to-day life?
See, like for that matter, for everybody, not only for premature graying hair, I always advise my patients to take well balanced diet, which includes good enough of proteins, salads, sprouts, green leafy vegetables, like 1 or 2 kinds of fruits daily, and taking good amount of water. Like a well balanced diet helps a lot to prevent other it acts as anti-aging process as well. It's very much
Right.
yeah.
And I'm sure you will also agree with me. There are people who know, because there's so much of information these days, right? So they are aware that if in case anything is happening with our hair, then it may be due to biotin or zinc or iron, and they'll go because these supplements, hair gummies, they are in so much trend these days. People, without asking or taking advice from a doctor, they'll go and get them themselves and start taking them. What's your take on these gummies and taking supplements without the advice of the doctor?
No, no. Supplements without a doctor prescription, which is available online, completely no. I know they are not medically researched, they are not FDA approved, and the proportions might not be, appropriate, like, and they might not be effective, but always go to a doctor. Take a like US FDA approved, doctor's prescription medicines are always safe. I know I tell to all my viewers, please, or when usually most of the people, when they come to my office for seeking either for premature graying or hair loss, they would have already tried 1 or 2 on-counter products or Instagram product, which I tell them, no, this thing, is it given by a doctor? Is it a research product? No, it's not. Like, how do you know whether they are like the safe on your liver, safe on your kidneys, like there might be any side effects. But when please don't purchase the on-counter products, which I really tell not. It might not be effective, it might not be safe on your body, but when you take with a doctor, definitely we always prescribe like US FDA approved drugs, which are where the vitamins are in correct proportions, micronutrients are in well proportions, and whatever is required only, like, and the dosage, adequate dosage is also advised by a doctor, and regular follow-ups are also required. And many days these gummies have, like, they might be with sugar, with, like, sugar is not good, like, and the color, non like, there are many coloring agents which are not suitable for your body, some animal extracts which are not suitable for your body, they're not research product. Definitely don't go for those kind of products. Always take a doctor prescribed product. Yeah.
Right. Many times, what happens, we waste a lot of time in home remedies or going by what the influencer on various social media platforms are saying, or what is available over the counter, on those products. We waste our money, we waste our energy, we waste our time, and most importantly, we waste our health. We risk our health. Don't go for these. Save your time, save your money, save your energy, and save your health by going to the right person, which is a qualified dermatologist. Seek the right advice, seek the right help from the right person. That's really important. Now, doctor, there is this very old saying that says that you should not pluck your gray hair. I'm sure you also have heard about it. So what's your take on this?
Yeah, there are many myths about, like, gray hair. People say, like, when you start plucking one gray hair, more gray hair will be grown. No, that's completely a myth. It is nothing to do with increase or decrease in the gray hair. No, plucking gray hair doesn't cause increase in the, like, gray hair, but like, frequent plucking of hair might disturb the hair roots, and it might go for infection or something, or there might be damage to the hair follicles, but definitely it will not increase the it will not increase the gray hair. Number of gray hair is not increased by plucking one gray hair. No, it's completely a myth.
That's a myth.
There are
Yeah.
many other myths. People stepping into my office tell that, like, coloring your hair is a solution for gray. No, it is not. Definitely, it is not the solution. It is just a temporary aesthetic camouflaging product where we, the hair color masks the graying, which gives a lasting effect. And many people say that does bleaching, like, leads to graying of hair? No, bleaching doesn't. No, bleaching is nothing to, not related to gray hair. And usage of shampoos and excessive shampoos and conditioners lead to gray hair? No, absolutely. See, shampoos are just cleansers which cleanses the scalp. It is nothing to do with the increase of gray hair, or even the conditioners for that matter. They are volumizers, like, they had to apply post shampooing to the length of the hair, and it gives volume and smoothness to the hair. It is nothing to do with the graying hair. And there is also a saying that, laser hair reduction reduces that. No, absolutely no. In fact, laser doesn't have any role in gray hair. It doesn't target, because there's no melanin in the gray hair. Laser is only for dark, thick, coarse hair. Yeah.
Right. As you have already mentioned initially also that, awareness is less when it comes to premature graying of hair. Now, for example, if there is a family where the parent have this or have had this, premature hair graying thing, what can they do for their kid, or what should that, kid, when he or she is growing, should do to prevent premature graying of hair? What can we do or take measures as prevention from premature graying of hair?
Yes, it's a good question, because awareness was less. If you ask me, maybe like 10 years, or, like, before, awareness was very less. People didn't know where, like, there is something called premature graying also. But yeah, these days, off late, I get, awareness has been increased in urban population. Like, parents get their children of 16 years, 14, like, even 12, 14 years also. And I'm very happy to treat them. At least the awareness is there, and it can be treated successfully. First and foremost, we have to identify any medical issue or any vitamin deficiencies, and we have to counsel them the lifestyle, and taking a good rounded balanced diet is the key. And lifestyle, like, any psychological stress has to be taken care, and lack of sleep also. So a good sleep is very, very important. Like, sleep has a very important role. And other things, like, if any vitamin deficiencies are there, that we have to take care. Yeah. And if everything is okay, still we give, like vitamin supplements, like calcium pantothenate 200 milligrams plus biotin and other micronutrients at least for 6 to 8 months, which are safer. But like parents and even the patients, like they have to be conscious about the long term treatment, like at least 6 to 8 months, and the results also, like it takes long time. The adherence to the treatment, the regular follow-ups is also important. And there are many safer topical preparations available, very good like products available in the market. The solutions, we ask them to apply on cleansed hair, on the length of the hair, on the gray hair. And they help. They has this these preparations has 5% melatonin, which is a like biomimetic peptide, and it also has an antioxidant in acetylcysteine. This helps in reversing the graying of the hair, arrests the increasing of graying of hair, and it also nourishes and repairs the cuticles. So this solution also has to be applied at least for 8 to 10 months daily. So this has to be explained. The results will be there, and I have treated in my a clinic successfully around 80 to 90%. I have seen positive results. And there is a low light laser therapy also, which really helps to reverse the pigmentation gradually, which is given once in 15 days, at least for 10 to 15 treatments. Yes.
Right. So treatment options are there. We just need
Are
to
there,
go and
yeah.
approach the doctor at the right time. That's really
Yeah. They have to identify at an early age, take precautions, follow the advices. Definitely, there will be an improvement. Yes.
And how long do we need to continue with the treatment? I'm sure it depends, but still.
Yeah, it depends. At least 6 to 8 months. Yeah, and they're quite safe.
Okay. We have a viewer with us, John Burgess, and his question is, can stress really cause graying of hair?
Of course, like stress is the main reason these days. Stress leads to, it damages to the hair follicles. What happens when when a person is stressed out? There is imbalance in the antioxidants and the harmful substance. There is an imbalance between these antioxidants and these free radicals. If we examine the hair follicle in a, when a person is stressed out continuously, there is less of catalase, which is an antioxidant, and accumulation of hydrogen peroxide. So this is called oxidative stress, where there is liberation of reactive oxygen species. So yeah, definitely stress is related to premature growing and also hair loss. So one has to take care of the stress, manage. They have to learn how to manage their stress. Yeah.
Right. So lifestyle modification, a good balanced diet, a healthy lifestyle, good sleep. This is what you
At
really.
least 7 to 8 hours of good sound sleep is very much required. Yeah.
Yeah. And Doctor, as we all know, and you also mentioned, while answering the other question, that people go for coloring, people go for hair dyes. So, and this is so common. Plus, there are so many products in the market with ammonia, without ammonia, and other products. For example, if people are still going for it, what's your advice? Is there anything that we should be, take care of? Any products or ingredients that we should not go for? What's your take on that?
Yes. See, there are oxidative dyes. Like there are non-oxidative hair dyes. There are permanent hair colors. There are semi-permanent hair colors, and like hair colors. I advise, like, and most of the good products are nowadays, which are available, are oxidative hair dyes, which are semi permanent. Like they last for 18 to 20 washes, and we have to do a root touch up. So these hair dyes should be always it should be ammonia free and PPD. PPD is paraphenyl diamine. That which, if there is PPD, there is more like chances of person getting contact dermatitis. And ammonia has carcinogenic potential. So it, like you see that the hair dyes are oxidative, and they are PPD free and ammonia free. Yes.
Right. One more question from a viewer, Akansha Puri, is asking, are there any health risks associated with premature graying?
Health risks, yeah, definitely, like premature, if there is underlying medical cause, definitely there is health risk. So, which has to be addressed. It's an indirect way of body saying that you should check your, like your blood work, you should check your any underlying medical causes, underlying vitamin deficiencies, or any other, like stress related things, consumption of smoking, alcohol. Definitely, all these are health hazards, like so if there is gray hair, definitely it is alarming, and you have to find out what could be the reason if it is below 25 years. Like, yeah.
Mhm. And before we sum up, doctor, any do's and don'ts for people who are, going through this phase of premature graying of hair?
See, premature graying of hair identified at an early stage can definitely be treated under good dermatological advice. Please go to a dermatologist, take the consultation, understand, like the course of the disease and what to do, what not to do, and don't go for online products or some other social media products. There are no natural products which helps graying, or there are no any other, there are no shortcuts. It takes long time, especially like regarding vitamins which are FDA approved, given by a doctor, and there are serums also given by a doctor. And you please follow the doctor's advice, because dermatologists are also trichologists. They know the hair, not only the skin. They know, they have studied the hair as well.
Right.
So they're the best guides. No, don't go on social media. Don't just pick up the products. Just it is seen shown very beautifully, and they look very appealing. No, don't go for that. Doctors are the best advisors. Yes.
True, true. Thank you so very much, Dr. Kavitha. It was wonderful talking to you. Thank you for your valuable time and this very informative session. Thank you so very much.
Yeah, thank you for you. Like, thank you for your time, and thank you for all my viewers. I hope this, session helps a lot, so that my like all the viewers understand that premature graying hair is definitely treatable, and early and adequate treatment. If they identified an earlier, definitely it is treatable, and there are like several treatments, safer treatments which can be taken care. So please don't neglect. Go to a nearer dermatologist and take a good treatment. Yes.
Right, right. So the bottom line is you need to go and approach a qualified dermatologist as soon as you spot the first,
Yeah.
few gray hairs. Thank you so very much once again, Dr. Kavitha.
Thank you. Thank you for your time. Thank you.
And viewers, thank you. And thank you for your excellent participation. Stay happy, stay healthy, and stay connected. Thank you. Have a great day ahead. Goodbye.
Yeah. Goodbye. Yeah. Thank you.